Hi, welcome back. All right, slide 4, physical health changes in appearance. So, of course, we have this primary aging that's happening because of biological changes over time. But we also have the secondary aging that has to do with the results of lifestyle. Primary aging, things like hair thinning and graying, bones becoming thinner, especially for women, age spots on our skin, height and weight declining, teeth yellowing, becoming less healthy. These are those lifestyle things that we can have healthier diet, we can exercise and move, and that will slow some of those secondary aging results. Let's move to slide 5, changes in senses and in the sleep. So we do see quite a few changes in each of the senses. We see lots of common impairments and other sort of conditions that happen with our different senses. So I touched on this a little bit about reduction in vision acuity and cataracts becoming common, glaucoma. These are sorts of areas that impact our sight or vision. Hearing, again, acuity is diminishing with those high-pitched sounds. We do have complaints of tinnitus, which is that ringing of the ears. And we know that the hearing can really affect us socially. Effects on daily social isolation increases when our hearing goes down. We also have a decline in taste and smell. Makes food less enjoyable. So we do see sometimes like aging, if you've smoked in your life, disease, certain medications, those are going to impact our decline in taste and smell. And there can be some danger if we can't smell maybe something dangerous in the air. Sleeping, again, quality significantly decreases after we're 60. We just sleep less deeply. Sleep apnea is a common problem as well. So people are waking up a lot in the night and not breathing as well. Let's move to chronic health problems. Okay, so major chronic health problems at the end of life. Over half of 65 and up in developed countries develop arthritis. So we see that cartilage around our cushions are wearing out and causes lots of pain. Women are affected more than men. Same with osteoporosis, right? The increased risk for broken bones. So we need to make sure we're exercising and having calcium-rich diets. And then last is hypertension, right? Over 65 in the United States, 65 years old, 70% of people are affected by hypertension. So we have to be careful about that secondary aging. Remember that lifestyle stuff, because that does worsen those conditions. Of course, looking at diet, medication, movement. Let's go to the next slide about healthcare and health promotion, the health effects of diet and exercise, etc. You guys have sort of went over this so many times, but of course healthy diet is important all throughout life, even very important in late adulthood. We need those micronutrients, we need low fats and sugars, obviously that link to heart disease with lots of red meat, we see it. We do see some foods related to higher risks for cancer and such. So health effects of diet are very important. The same with exercise, right? With our bone mass, our muscle mass, risks of disease. So we need to be doing aerobic and strength training, especially as we're going with age. Unfortunately, though, participation exercise does decrease with age, and it's kind of the time we need to be exercising even more. Automobile driving, really kind of interesting. We're looking at health promotion because adults aged over 75 actually have a higher fatality rate than 16 to 20-year-olds when we're talking about car crashes. Major threat to the health, in especially developed countries, to our elders. We think it's because it's hard to give up driving. We have those declining sensory abilities that I noted. They're going to make driving a little less safe. Smoking and drinking, of course, we have talked about the detriments of that. Rates of like lung cancer are decreasing. Less people are smoking in developed countries, and it's the opposite. In developing countries, rates are rising. So, moderation here for drinking and to avoid smoking. All right, this is it for physical health for end of life, late adulthood, and then I'm going to pick up here in cognitive in a moment.